In this video, we're discussing pericarditis. That's inflammation in the pericardium, the serous membranes that cover the heart. So if you have the heart, you have this serous membrane that goes around the heart and provides some protection. It's kind of has some fibrous tissue on the outside, and it has some fluid here that will help lubricate and allow everything to kind of move smoothly when the heart is pumping. So imagine during embryology, you have the heart growing into like a balloon, and the balloon just kind of wraps around the heart. That's why you get two layers. You have this balloon that kind of wraps around, and you have a visceral layer that's touching the organ, in this case the heart. And then you have the parietal pericardium, so the parietal layer is out here. And then you have a little bit of serous fluid during normal conditions in that little cavity there. So what are the symptoms that people have when they have pericarditis? Sharp retrosternal pain that's pleuritic. Pleuritic pain means that during inspiration, there's more pain, and then it kind of subsides during expiration. And the pain is real stabbing, so you can differentiate that from a heart attack, which is more of a pressure, like an elephant sitting on your chest, kind of pain in the chest. So these are both chest pain, just one is more of a stabbing pain. And you can also look for a Kussmaul sign. So when you inspire, your intra-abdominal pressure decreases and blood tries to kind of go into the right side of the heart. And if there's some restriction, so that it's kind of getting irritated and gets fibrous and restricted, that's called constrictive pericarditis. Then you can look for a Kussmaul sign, which is the blood's trying to go into the right side of the heart, but it can't because that restriction is preventing the heart from opening up during diastole. So the blood will kind of rush up into the jugular vein, and that's called Kussmaul sign, and it causes jugular venous distension. So that's a complication of pericarditis. Some other causes are drugs. Paradoxically, one of the main drugs to treat tuberculosis is isoniazid, and it can also be the cause of pericarditis. So that's kind of paradoxical. And then hydralazine is a drug that is used sometimes to decrease blood pressure by dilating the arteries, and it can also be toxic to the membranes of the heart, or the outer membranes, the pericardium. Post-MI, this is something you have to watch for. After someone has a heart attack, for about 2 weeks, they're susceptible to pericarditis. And if they get pericarditis kind of during that post-MI period, it's called Dressler's syndrome. And there's other causes that are non-infectious, they're less common. Malignancy, renal failure, you can be just idiopathic. They don't really know why, but you have these symptoms that you see, the positional chest pain, the pleuritic pain, the sharp chest pain. So if you are diagnosed with pericarditis, there's some treatment options. You can find whatever, if it's a bacterial infection, you can do an antibiotic that's geared towards that bacterium. If it needs to be drained, you can do like a needle aspiration and drain some of the fluid out to decrease the pressure on the heart. And if you have constrictive pericarditis and you can't get blood into the heart, that can lead to hypotension and cardiac arrest. So they might have to remove the pericardium through surgery. Another treatment is just anti-inflammatories to decrease the inflammation. This might be some kind of NSAID like Advil, or it could be something like colchicine, another anti-inflammatory that's commonly used for pericarditis. And then you can have kind of the worst complication is where basically this gets filled up with something like blood. Maybe you have a traumatic injury where your steering wheel hits your chest, and it causes pericardial effusion, where blood fills up that little space that typically doesn't have a whole lot of fluid. That's going to put a lot of downward pressure on the heart. It's going to prevent the heart from filling, which is going to decrease the cardiac output, which is going to decrease the blood pressure and lead towards cardiac arrest if something's not done quickly. So the typical thing that's done there to get immediate relief is pericardiocentesis, where a needle aspiration is pulling out that fluid. So if they have tamponade, when you do an auscultation, typically just regular pericarditis, you'll hear a pericardial rub, like a rubbing like almost sounds like Velcro. But if they have acute pericarditis and it leads to tamponade, the heart just kind of sounds distant and muffled. And so that's one of the, the lub dub is just kind of in the background, just kind of muffled there. So that's something that, if you don't get a good sound, you need to check out for the tamponade. So that is pericarditis, and I'll see you in the next one.